Most people are affected by hair loss, also known as alopecia. Men and women often have genetic hair loss, and it comes from both sides of your family, your parents. And then there is a very common form of hair loss that is due to stress, and it can be a medical stress or illness, or it can actually be emotional stress. It's called the telogen effluvium, and it usually resolves on its own over time. Then there is another common form of hair loss called alopecia areata, which is an autoimmune form of hair loss where you get bald patches that can extend to actually total hair loss. And then there are the scarring alopecias, which are quite a few different diseases where you actually get scarring of the scalp. And those are fairly serious because if you don't treat them right away, the hair will not grow back. Some early signs of hair loss could look like widening of your part, a recession of your hairline. You may notice increased shedding. Obviously, bald patches are more obvious. You're going to notice that. Itch and pain also can be precursors to some of the more serious forms of scarring hair loss. So those are symptoms to look out for. Diagnosing hair loss is actually fairly complicated. Sometimes it's not if it's just obvious genetic pattern of hair loss, but it usually requires an extensive history. So lots of questions, which is why Donnelley Dermatology is a great place to come because we have that extra time to spend with you. A few other causes of hair loss are actually things that we discover via blood tests. So iron deficiency anemia can cause hair loss. Thyroid disease, common cause of hair loss. I do biopsy the scalp not infrequently to determine exactly what kind of inflammation is going on and what the cause of the hair loss is. And those are the primary ways we diagnose different kinds of hair loss. At Donnelley Dermatology, treatment for hair loss is usually medications. There are wonderful medications that treat genetic hair loss, and there are also wonderful medications that treat alopecia areata. In hair loss, as with many dermatological conditions that can be very emotionally triggering, it's very important to manage expectations. Not losing any more hair is considered a success. So if we can stop that process, halt that process, that is considered a success. We can often help you regrow your hair. That is kind of considered a bonus. I'm not saying that it's rare, but that is a bonus. So we do want to be very realistic and manage your expectations. At Donnelley Dermatology, we understand that hair loss can be a very emotional, upsetting issue, and we are here to help you through this process in terms of best care possible, education, reassurance. We will be with you as you go through your treatment journey and give you the best outcome possible.